Hi there, my name's Claire Maxwell at Embodied Learning Systems. Today's video is about how to recover mobility after a total hip replacement. And please note that I'm talking about mobility, which is the easy relationship and fluidity of all parts of your body in relation to each other, as opposed to flexibility, which is like, oh, I can, twist myself into a pretzel. So we're just talking about the juicy mobility that you are longing to have after been living with pain for so long. So I'm going to show you a three-tiered process. And the first part happens on your bed. And then the second part, when you do get a little bit more mobility, you can go lower to a couch and eventually even to the floor, all without breaking the 90-degree precaution that your surgeon's going to give you. So they do not want you to bend your hips past 90 degrees. Okay, so here we go. Here's the first part. So I have a nice high bed here. It's just a little bit higher than my hip joint. You can find your hip joint just by folding your good leg and kind of feeling in there. And then you see where that is. So I'm like an inch higher than my hip joint, and that's ideal. If your bed isn't that high, you can add some kind of blanket or pad so that you just don't have to worry about flexing too far. Okay, so the first part is releasing your knees forward into the bed. So you may notice if your knees are straight, there's a little bit of effort in your lower back. If you bend your ankles and knees slightly and you release your knees forward into the bed, you'll get a release in your sacrum. So that's the beginning. It's a little bit of a slight backward movement. So you might even see the floor, see your body come back a little bit. So that's your spring. And then from there, you walk all the way out. And you can let your knees straighten, but you're not pushing anything. And then reach your hands out as far as you like. I'm going to bring mine back so you can see me. And really let your head rest. Let your back muscles go. You'll notice that if you send your knees forward, it will release all the fascia and tissues around your pelvis. And so you can experiment with where is most comfortable. Maybe you use your knees to send your pelvis back a little bit, and that feels much better to you. Feels nice to me right now. Then, if you bring both hands back, really releasing the weight of your forearms, your hands, and your elbows into the bed so that all the big muscles of your shoulders and your neck and your back are not contracting. You give a gentle push with your knees forward, your heels down, and a gentle push from your elbows to come back. You can rest your head and curl your back a little bit more and just go gently back and forth, sending your knees forward and your head forward. What you may notice is that your head will rotate this way, rotate that way, rotate this way, rotate that way. So it's a little micro movement that involves the top of your spine, where it meets your head, your hips and sacrum, your knees, and your ankles. Oh, such a relief. And you can repeat this as many times as you like. And find your own variations, pulling back, Going forward, and then using your hands to bring your weight out and up over your feet again. When I first discovered this, the relief, my sacrum was so tight, I was just in a state of bliss. And I wouldn't worry too much about the precautions, because the truth is, you're going to be so tight in your hip after the surgery, you're probably not going to be able to break the precaution physically. So try to let go of the worry and the fear about that and start to work with micro movements. Okay, stay tuned for the second and third variations. Okay, so here's part 2 and part 3. I have this little couch that's a little bit, I don't know, it's about twice as low as my bed. And I can begin here. And what I found was I could look down, place my operated leg back, and get my weight here, and then walk forward. Now, this is where I can begin to, especially looking down is better, experiment with going a little bit further than 90 degrees in the very beginning when I'm off my precautions. Sending my knees forward, my heels down, dropping your head, and extending out and pushing back. Whoops! I still feel a little tightness in my operated leg, and I'm like 4 months out. So this is nice because I can use it as a support to get down. So it's the same movement. And I can then use this prop to start literally crawling. So by placing my operated leg behind me, I'm not going past 90 degrees. Now, if you had an anterior hip replacement, you won't be able to do this because they have precautions for you putting your leg behind. So these second ones probably won't work for you until after your precautions are lifted. So here I am. I can do the same movements without really flexing my hip that much. And you can come up on your, what are they called? Your knuckles, if your wrists are not happy. And what this does is it starts to juicify your legs and your pelvic joint, but you don't have to actually crawl the way you normally would. You can just keep thinking, oh, I'll leave my operated leg slightly behind me, just slightly behind me. And eventually, I started to, after my precautions were lifted, miniature, continuing to think of my knees going forward, and then putting my weight on my hands, taking the weight onto my knees and really sending, I would say, your tibia bone forward. And that really allows you to release your head and your back. And then I got to the point where I could put my elbows down. And that's kind of where I am now. And so as you look out and you put the weight on your hands, then you can bring your operated leg back underneath you. Okay, so you will get your mobility back, and your flexibility is a side effect of your mobility. Don't push flexibility. Start just getting the whole body, all the parts moving. And so this kind of four-legged experimental movement backwards and forwards is excellent for that. Okay, thanks for watching. Hope that was helpful.